Hi, everyone. We're going to go ahead and get started so that we're on time today. We've got about 30 minutes, and we had several people sign up. So I'm looking forward to seeing everyone kind of come in as we just do a quick introduction here. We are dietitians with the Nutrition Clinic for Digestive Health, and we have training in functional nutrition, and we specialize in solving digestive problems. So we're really excited to be here today. Office hours are something that we offer for free, normally for our current clients, and it's just a time to kind of sit around and talk and catch up on a current topic and give you guys a chance to ask questions. We love participation, so if at any time you have a question, you can just pop it in the chat and we will be happy to answer it for you. Today, we're focusing on probiotics. We're going to be talking about myths and facts and sharing our favorite ones with you guys. So this is a really hot topic. A lot of people take probiotics or have tried probiotics or have heard they should take a probiotic. So today we're going to kind of dive in and talk about really like what best practices are with probiotics and how to take them so that they work and how to know if you're taking the right one. So we've got a lot to cover. And we have a special giveaway that we decided on right before this meeting. We actually have a really awesome ebook on probiotics, and it's over 20 pages. Actually, I'm looking at it right now. It's 45 pages long. It's everything you could ever want to know about probiotics. And I think the most important thing, and Rachel and Erica, you can tell me if there's another really important thing, but when it comes to taking probiotics, the most important thing is making sure that you're taking the right one because they're not all the same and they are actually strain specific, meaning, and this is really cool, that there are certain strains of probiotics or bacteria that help with different conditions. And this book that we're sharing with you guys today is something that we're eventually going to sell. You guys are going to get it just for being here, which is really cool. It breaks down all of the probiotics and all of these conditions, and it tells you what to take for which condition. So it's really, really going to be helpful. And just so we're all on the same page with probiotics and what they are, probiotics are strains of bacteria. They're beneficial bacteria. We work with digestive health, so I'm always thinking about the ones in the digestive tract, but we actually have probiotics and bacteria all over the body. But when we try to balance out digestion or help someone overcome their digestive problems, what we're doing a lot of times is balancing out the bacteria in someone's gut, be it the large intestine or the small intestine. We're working to get rid of any unfavorable bacteria or bacteria that's causing symptoms and repopulating the gut with healthy bacteria. So that's really a huge, huge part of what we do. And it's super important to having a happy and healthy digestive system. It's just having the right balance of bacteria. So today we're covering some myths. And one of the things that I come across a lot is people thinking that taking a probiotic made them feel worse. And sometimes that can be the case, but a lot of times, depending on how you take a probiotic, it can determine if it's going to help you feel better or worse. So specifically, I'm thinking about my favorite probiotic, Megaspore Biotic. And if you're my client, I've probably recommended it to you at least once. And this one is very, very potent because it's highly effective, as are all of the probiotics we recommend. And one of the best things you can do when you start taking a probiotic is start it at a half dose and do a half dose every other day. So for example, Megaspore Biotic is a 2 per day probiotic, but we recommend you start with 1 per day. And if someone's really in a digestive pickle, I will say start with 1 a day and take it every other day for the first week. And then for the second week you're on it, you want to take it every single day. And then the third week, you can do the maintenance dose, which is 2 per day. But if you're going from a very unhealthy or unhappy gut and throwing probiotics at it, those probiotics will kill off bad bacterial or overgrown bacteria or even yeast. And you will have some turbulence in there. It's going to be a disturbing situation for sure. So if you start it slow, then you can have a slower die-off and a slower introduction period and a slower repopulation of the gut, which is going to give you a lot less symptoms. So that's kind of my big thing, is that it's not necessarily the probiotic made you feel bad. It's that the probiotic was actually helping you, but it made you feel bad because you took too much at once. Another one that I really love of my favorite probiotics is Orthobiotic because it has Saccharomyces boulardii in it. So this is going to be my brand pick of that. And honestly, Megaspore is my other favorite one. It's Megaspore Biotic by Microbiome Labs. The reason I love orthobiotics is because it has lots of different strains of bacteria, but it also has Saccharomyces boulardii. Anyone with diarrhea will benefit from Saccharomyces boulardii. It's a strain of yeast. It's friendly yeast. A lot of people have yeast overgrowth, which can easily lead to diarrhea. So if you've been suffering for a while, especially with diarrhea, you've got to consider yeast as an issue. And you guys, one of the things too that really drives overgrowth of any sort, be it bacterial or fungal like the yeast, is antibiotics. So if you have a history of antibiotic use and you're having digestive problems, a probiotic is probably a great idea. But like we said, you've got to be taking the right one and you've got to do it the right way. So the Saccharomyces boulardii is a friendly yeast that helps dry up the intestinal tract and it can stop diarrhea pretty quickly. So taking a probiotic that has Sac B in it is very, very helpful. And then my other pick for my favorite one is Megaspore. I've always been a huge fan. It's got different strains of probiotics. It's also soil based. So it's going to be better at populating the gut than other types of probiotics. It will survive the trip down to the intestines and repopulate better than some of the ones that aren't spore based. So those are kind of my picks. I'm going to pass this off to Erica, and she's going to tell us about her favorite myth about probiotics and also her favorite probiotics.
Okay, so my topic can get a little complex, so hopefully I don't lose you here, but I really wanted to talk about histamines. And we often just think, oh, I just have regular allergies. My whole family has allergies. No big deal. I take an antihistamine. Well, what we find is a lot of our patients with gut issues also have histamine issues, and it's more so related to the gut bacteria that they have or don't have. And a probiotic actually can make histamines worse. And there are some probiotics that degrade or get rid of some of that excess histamine. So when we talk about histamines, you probably think about the typical runny nose, itchy eyes, but it can actually also speed up motility. It can cause diarrhea. It can cause anxiety. It can cause skin issues. So there's different types of histamines as well. So we really want to bring down the histamine load, make sure we have things in place that help degrade and break it down. A lot of our patients are on a low FODMAP, and I often equate it to that, how like the low FODMAP diet, you fill the bucket and when it overflows, that's when you get the symptoms. The same sort of thing happens with histamines. So when that bucket overflows, that's when you get all these sort of responses, and it's an inflammatory response. So we really want to calm that down, reduce the histamines. So actually the first place I like to start to test or trial it out is with a low histamine diet. So some of the typical things you think about that are gut friendly, like sauerkraut or kimchi or kefir, those actually are high histamine. So if you all of a sudden start eating those foods, it could also be, other bacteria overgrowth, but those foods also cause a histamine response. So, those foods, fermented or cured meats are another one, pickled sort of food. So think about things that are aged. Those are really all high histamine. Alcohol is one that speeds up histamines and causes a block in the breakdown. So alcohol's a double whammy when it comes to histamines. Dried fruits, and then some healthy things. And I hate to ever limit the diet, but avocado is one that tends to cause histamine issues for people as well. Chocolate, vinegars. So it's really a diverse list, but this is something that we work with our patients on and help to come up with the right diet for you. So as far as probiotics, so first I'll always go on a low histamine diet, and that's a short-term thing to help us figure out where are we having the issue with the histamines. So there can be, like an imbalance of the bacteria. So that's another really important thing. So the GI effects, the test that we do, we look for very specific strains that increase histamines. Klebsiella is one of the biggest offenders of that. Citrobacter, Pseudomonas. So when we look at your stool test, we're looking for those things, and those are the ones we'd want to bring back in balance. Another issue is leaky gut. We need to make sure we have those good commensal bacteria. So something like megaspore that Jenny talked about would be a really good one to incorporate back in. My other favorite brand when we talk about histamines is Seeking Health. That's a brand of probiotics. They have multivitamins, they have specific nutrients that help with histamine degradation, and then the enzyme needed for breaking it down. So I know that's a whole lot of stuff. That's why we're here to help you with that. But you could be taking a probiotic that increases histamines. So Lactobacillus casei, that's a common one, and it actually increases histamines. There are a couple other lactobacillus strains. Streptococcus is another one that can increase those histamines. So you want to make sure that when you're looking at your probiotic, if you have histamine issues, you're having more things like Lactobacillus plantarum, Lactobacillus rhamnosus, and then Bifido infatis. I know these names probably sound it's hard to remember, but Lactobacillus lactis and Bifido longum. All of those are really important ones for degrading or bringing down that histamine response. So again, Seeking Health has a really good probiotic. Histamine X is the probiotic name, and that one will also help when it comes to the gut in breaking those things down. Hopefully that made sense. Do you ladies have anything to add related to that?
I think that was awesome. I just think, if you have issues with histamine, the big question is, why do you have them? Right? Like, we want to get to the bottom of that. That's kind of a symptom. It's not something that people should be living with.
Yep. So there is a test we do that we can see, is it the enzyme? Is it a histamine overload? And that's after we tried low histamine diet, we rebalanced the gut. And it can also show up mast cell activation syndrome. That can be very similar, but they're different. So we always want to make sure which one are we actually dealing with.
Yeah, awesome. Rachel, you want to pick up, and you've got some really cool topics to talk about today.
So I'll go ahead and get started. So the first thing that I was going to go over is, and Jenny kind of started touching on this a little bit, which is what probiotics are good for constipation and what probiotics are good for diarrhea. Because I feel like in order for you to have effective probiotic supplementation, you really have to be taking the right strains for you, because everyone has different needs. And I feel like as dietitians, like anytime you tell people you're a dietitian and that you work in GI, the first thing they ask is, oh my gosh, what probiotic do you think I should be taking? What's your favorite one? And we do have favorites, and we do have probiotics that are all around great, but you really want to personalize it for what your goals are. So if you're somebody who is struggling with motility, with going to the bathroom every day, there are a couple of strains that I would recommend. So Lactobacillus reuteri has been shown pretty strongly in the literature and research to be helpful with constipation. So it's definitely a strain for you to be looking out for. I don't know about you guys, I love Megaspore Biotic too for constipation. It just really, really helps people stay regular. And I feel like anytime I have a friend, it's like, all right, I'm having trouble going to the bathroom, what do you recommend? I actually tend to go for that one even more than Lactobacillus reuteri, because it's just including more strains. It's just a more diverse probiotic. So you can try a couple different things. I've done a blend of those together. I've tried just the Lactobacillus reuteri, and feel like both of those are great for constipation. Also, in general, I tend to see that people that have low bifidobacteria, lactobacillus on stool testing tend to have trouble staying regular, because you really do need a great combination of all of these things for your bowel movements to be pretty regular. But I feel like that's also another great spot where if you don't want to be taking 3 different probiotics, which is totally fair, you can lean on to food. Fermented foods, all sorts of food to kind of help bring the lactobacillus and bifidobacterium up. Kombucha, sauerkraut, all of those yummy foods are a great option. And like Jenny said, our favorite for diarrhea is going to be Saccharomyces boulardii. It also plays a role into increasing brush border enzymes in the small intestine, which I think probably helps make a huge difference. I tell everyone that works with us, our little trick is like, always have an in case of emergency kit. The stomach bug hit my house recently and I was unprepared, and never again. just always have some on board, because if you ever have some kind of stomach bug or anything happening or food poisoning, Saccharomyces boulardii, I mean, you want to let things run its course, but it can help with that healing and kind of getting things back into shape after you've been through that. Also, anytime you're taking an antibiotic, just go ahead and add that Saccharomyces boulardii in. Recommended dosage for diarrhea, you can take 1 capsule up to 3 times a day. So start with 1, not getting the progress you want, move up to 2, and then you can move up to 3. So that's the way you can kind of tailor your probiotic supplementation as far as what you have going on with bowel movements. Anybody have anything to add about that before I move on?
I'm just really happy you talked about the prebiotics and the things that actually feed the probiotics, because that's a huge piece of it. I think for the longest time, we thought we couldn't replenish lost bacteria in the gut. And now we're finding, by feeding the bacteria, putting the bacteria there, we're actually seeing patients have totally different gut compositions because of it. So good
Yeah.
point.
And I kind of have a little tangent on that I think kind of goes into it, which is like a lot of times people will come to us. Oops, I didn't mean to do that. I just talk with my hands a lot and Zoom doesn't love that. People will come to us taking a probiotic that has a prebiotic in it and they're feeling so bad. And sometimes we got to pump the brakes a little bit on prebiotics and kind of figure out what's going on before we add prebiotics, which is food to feed your probiotics, right? So a lot of times just starting with a probiotic is great. Give yourself a month, make sure your gut health is in order, and then you want to start bringing in those fibers to really help build that robust microbiome. So
Yeah,
great.
too much too fast is not good. We call it the slow and slow approach when adding probiotics or prebiotics or fiber, for sure. And this reminded me of a couple weeks ago, you guys, when we were in a meeting and we were looking at a stool test and the commensals looked good. And we realized that the patient was on a probiotic when she did the stool test. So normally we have people stop probiotics for stool tests so we can get a true read of their baseline. But this client was, I think she was on Megaspore. Do you guys remember that? And
Yeah.
her, like, really, truly, like, her commensals looked really good. So it's just, we know it works because we see it work with people. We've used Megaspore on so many people. But when you actually like see the evidence in a stool test, it's really cool. It's really reaffirming.
Yeah, I think something that ties into that too, Jenny, that I've seen with stool testing, myself as an example, because I've done the GIFX 3 times now, is the importance of rotation. I love Megaspore Biotic, but I was on it for 2 years without rotating, and I noticed that I was heavier in the family that it really helps lift, and some other areas needed a lot of love, and this is where you can also really personalize it to what you have going on. I don't know, I don't see any of my clients on here, but I went through a C-section last year, had about antibiotics, all sorts of things going on, and really started adding in more Saccharomyces boulardii, like different women's health strains. So things will change at different points in your life and throughout the year. And so it's really meant to be so that you can tailor it to your own needs. And I think that's so important. And that's where I think we can really come in and help you guys if you have any issues with that. But the last thing that I was going to touch on today was actually women's health specific probiotics, because that is something that comes up a lot. A lot of times when people come to us and they have issues with their digestion, a lot of times as a side effect, you can have yeast infections, UTIs, all sorts of issues with the vaginal microbiome as well. So, your digestive tract is not the only microbiome you have. We also have the vaginal microbiome. Your mouth also has its own balance of bacteria as well. If you are someone that has that tricky yeast infection that pops up or struggles with UTIs, probiotics can actually be a really great tool to help resolve all of this. And the 2 most studied strains of probiotics are Lactobacillus rhamnosus and Saccharomyces boulardii. We use Saccharomyces boulardii. I feel like we've talked about it all day with yeast infections a lot because, like Jenny was saying, it is a probiotic yeast. So it really helps with the balance of yeast in the body. And then that Lactobacillus rhamnosus also helps with UTI prevention as well. There are other things that you can add to help prevent that too, specifically like cranberries for UTI, for yeast infections. You know, a lot of times, sometimes doing the antifungals can mess up the balance of the yeast even more. So, probiotics and the way that you're eating and getting your GI tract in shape are a great way to kind of avoid those things from popping up. Microbiome Labs actually just came up with a probiotic called pregnancy support. It's meant to be specifically tailored. I would say it's an overall women's health one, right, Jenny? I think the only reason why they're marketing it specifically around pregnancy and breastfeeding is because they have a bifidobacterium infantilis, which is one that you want high amounts of in breast milk. But that I think is a great one for anybody looking for a women's health one. And then Metagenics has a women's health flora. It's so interesting because I have a specific client that comes to mind that had issues with those all the time. And we did a stool test. This is back when we were using Vibrance a couple of years ago, and they specifically test for Lactobacillus reuteri and Lactobacillus rhamnosus. And she was low for both of that. So that was an easy, like, go ahead and lift those up. And I think she saw, like, remember seeing her get really good improvement from doing that. You guys have anything to add?
I was going to say, reuteri also is really good for anxiety and depression. So they're not only just, each strain isn't just to one specific thing. There are a lot of different things that it can help with. So I really do like that one. And like you said, rotating is really important. And then going back to thinking about feeding the bacteria, another one strain that's really talked about is Akkermansia. So if you're looking at probiotics, that's one we also test on the GI effects, and it has a lot to do with metabolic health. And when we see people on a lot of antibiotics as a child, some of those keystone bacteria like Akkermansia tend to be really low. And there are some really expensive probiotics out there that have Akkermansia in it now. And what we've even found is just feeding the Akkermansia. So this is more of the polyphenols, so cranberry, pomegranate, those specific things will feed that Akkermansia and do an even better job at increasing your levels. So just another side note.
Yeah, Akkermansia is such a hot topic right now, and we've seen and are kind of suspecting with testing that it might not be like directly supplementing with Akkermansia that is the most beneficial. It's actually prebiotics that support the production of Akkermansia. So once you get your probiotics worked in, then you can work on the prebiotics and you'll be benefiting Akkermansia levels, which is hugely important. And one thing you guys both touched on, which I love, is rotation of probiotics so that we're not overpopulating. There are, I think it's trillions of bacteria in the small intestine, or millions or billions. There's a ton. So like, we're not going to get it all with one probiotic, right? So we rotate probiotics for that reason, so that we have the best chance. Because the key with a healthy gut is having diversity and abundance of good things, and balance, right? It's kind of trying to hit all three of those things. So one of the ways we do that is by rotating probiotics, but another way that we do it is by having a lot of variety in our diet too. So it's not all about popping probiotic supplements. We have to have a varied diet to feed the different bacteria and to keep everything happy. And one of the things that hit me the hardest that I keep thinking about is when we were meeting with one of the clinicians at Genova, Dr. Powell, and she was talking, I think you were in the meeting, Erica. She was talking about how people use Instacart these days and that how that makes it easier, or any sort of ordering of groceries, how it makes it easier to just reorder the same stuff every week. And our diets, I mean, we're not eating a less varied diet because of Instacart, but like if you're not really aware of your orders every week and like what you're doing, if that's how you shop, like I do think you're more likely to just repeat stuff when you're ordering groceries online. I thought it was really interesting. It's like, gosh, I kind of do that. Like I have saved lists in my cart and I order from those lists. So like personally, I mean, as dietitians specializing in gut health, we are always experimenting with different things and, working on ourselves and our eating habits and things like that. I was like, wow, like our family really needs to do a little bit better because it's just so easy to like reorder the list. So that, like the food piece too, right? Like rotating different like fruits and vegetables and getting all the different colors in, and just being aware of, if you ate this last week, maybe you choose something like different, the following week when you're at the store placing your grocery order.
When we look at those stool tests, we can see patterns on the different phyla, the like families of bacteria. And some phyla are more plant-based, some are more lean protein based. So I've had a couple patients that did carnivore or keto for a while, and you can see their whole pattern change on those tests. So it has so much to do with diet. Probiotics are just the icing on the cake.
Yeah. Another way that we kind of affirm all the testing that we use is we're always, with all of our tests, I feel like you could paint a picture of the client from the test results without knowing the client's story. So to me, that's just a really powerful affirmation of how effective and accurate the testing that we use is. So we've got a few minutes left, and I want to make sure we respect everyone's time today. Just want to sum up what we've talked about, and Erica and Rachel, feel free to jump in. We focused a lot on personalization and making sure that you're taking the right probiotic for what you need, and strain specificity is huge. We've talked about the best practices for taking probiotics. So we like the low and slow approach, working slowly up to a full dose. We've talked about some special conditions that probiotics help with. They can help with a lot of things, but we've gotten really specific today with women's health. We've talked about specific strains for diarrhea, constipation, histamine, even a little bit about anxiety and depression. Probiotics and the gut in general plays a big role in mood. We've talked about rotating both diet and supplements and probiotics. What else? What other kind of like take home points or summaries, and also questions? If anyone has questions, we're happy to hang out and answer those. You can pop them in the chat or unmute.
I think you did a really good job at summarizing.
Awesome.
It's a lot.
Yeah, we really did cover a lot in 30 minutes. So yeah, happy to take questions. Rachel, anything else you can think of?
No, I think that the only other bullet point I had on my list, which I feel like we kind of touched here and there, but which is a myth that I feel like I hear a lot, which is that everybody needs probiotics and everyone should be taking a probiotic, which I would say most people do. But there are some tricky cases where if your problem is that you have a bacterial overgrowth, I still think that a lot of times you can use from repopulating some of the good stuff to crowd out some of the things that aren't great. But some people really just have too much of it going on, and they need strategies to reduce a little bit and make their migrating motor complex more efficient, work more efficient. So there are certain situations where somebody might not need a probiotic, and know that that's okay. There's nothing wrong with you. All of our needs are different, which is why a lot of times we recommend testing and not guessing, but it's a case-by-case situation.
Yeah, that's a really good point. Not everyone needs or benefits from probiotics. The other thing I would just say in conclusion is that, like, ideally, if you are on a probiotic as part of your wellness journey or, wellness protocol, taking a probiotic every day is great, but also would be really intentional about getting a serving of a probiotic food too. So kefir, yogurt, sauerkraut, like, have it in your diet. Don't just rely on the supplement. I think having both is a really powerful combination.